What's up everyone, I'm Jace of Defy Fitness and herniasurgeryrecovery.com, and I'm here at Shouldice to have a follow-up appointment with Dr. Simmons, as it's been 4 weeks since my hernia surgery. So let's go. As you can see, I can get out of the car easily and walk normally now too. Before I head in, here's a quick recap of my walking. This is the day after surgery, walking gingerly around the room and definitely in pain. 2 days after surgery, walking still pretty slow and with a limp, in less pain but still in pain. 4 days after surgery, walking slowly but more upright and pain reduced to uncomfortable but manageable. 10 days after surgery, walking at a normal pace, slight limp still, and just a little discomfort when I'm doing too much. And now, 4 weeks after surgery, walking completely normally with no limp and only pain when I do too much. So let's also do a recap with my wound. Just a warning with the upcoming pictures, as it may be disturbing to some viewers. Here we go. Day 1 after surgery. Surgery wound fully clipped and very sore in the surrounding area, and the area is very swollen. Day 2 after surgery. Surgery wound is half clipped and still sore in the surrounding area and very swollen. Day 3 after surgery. Surgery wound clips are actually all taken off and I'm still sore, but there is a bit of relief, but still sore in the surrounding area and very swollen. 1 week after surgery. Surgery wounds feel a bit better, a bit numb to touch, and a bruise feeling still there when I press firmly in the surrounding area. With the swelling coming down, you can see the wound ridge appears more raised. 4 weeks after surgery. The surgery wound feels great, but some numbness and some sensations are coming back, and still a bruise feeling when I push deep in the surrounding area. The ridge actually appears higher than it is due to the swelling almost gone. Okay, so now workout wise, I was weightlifting right up to the surgery. 4 days after surgery, I was back in the gym, but only on machines and lifting maybe 10 to 20% of what I was doing before surgery. Over the next few days, I gradually increased the weight based on how I felt from the previous workout. Now, by day 10, I found myself to have a breakthrough and felt really good in the gym. That week, my workouts were probably 75 to 85% of what I was doing before surgery, with the exception of a couple of exercises. There are 2 exercises that I have not been able to get close to what I have been doing before surgery. The first is the leg press. Now, when I'm doing the leg press, I perform these with a large bend in the hip, and this presses against my hernia wound, which I feel isn't ready for the physical compression. The other is the lying leg curl. The curve of the pad presses right onto the surgery site, so I have to lift up my hips to prevent the pressure pushing into the pad. So because I'm modifying my form, I have not been able to do these effectively as before. Okay, let's head back to Shouldice with my 1-month consult with Dr. Simmons. So he checks the hernia site standing as well as laying down, and great news is everything looks good. So that's my 1-month follow-up after inguinal hernia surgery. I'm Jace of herniasurgeryrecovery.com and Defy Fitness, and I'll see you in the next one.